Welcome to our COVID-19 Task Force update. We are living in strange times. Yes, we are. But as we have said all along, stay on top of it as much as we can. Joining us today, she'll be our only guest on the program, is the Executive Director of the Kahnawà Memorial Hospital Centre and a member in good standing of the task force, Lisa Westaway. Lisa?
Thank you, Joe. So I have a bit of mishmash of information to provide to you today. First off, I'd like to just start with what's happening around us in Quebec. So Legault announced today that starting Saturday, anybody who is not following masking rules in Quebec can or will be fined. So I think that's important information for the community to be aware of, as it may impact you when you're using services outside of Kahnawà. So please keep that in mind as of Saturday. Police will be enforcing more in zones that are in an increased vigilance state, so areas that have more positive cases. However, you can be fined anywhere in Quebec if you're not following the masking rules. Also want to talk just a little bit about what's happening around us with respect to numbers. So we know that a few short weeks ago in Quebec, we were hovering around 50 cases per day. And more recently, we moved up to 100 cases per day, and we've consistently over the last week been hovering just under 200 cases per day. So we do see a gradual, slow increase in number of cases in Quebec, and we can see because Quebec has been providing a lot more media announcements, there's been a lot more attention on COVID again in the media. We see that we're really starting new sensitization campaigns about maintaining measures, distancing, masking, hygiene, in order to be able to try to keep those numbers at a minimum as much as possible. So those numbers are really important to us as a community because they have an impact on decisions that we make as well. Firstly, because we ourselves, when we're using the services around us, have to be extra cautious. And again, so we need to sensitize you on a continuous basis for that reason. But we also use those numbers, especially those closest to Kahnawà, to be able to make decisions about where we're going and how we plan for the future. So I thought it would be important to share just a little bit about discussions that we've had with Dr. Gauthier in making decisions about how we reintegrate stricter control measures into the community as we move forward, so that you're prepared for that. And it's a bit different from what they're doing in Quebec. So in Quebec, they're focusing on a weekly average per 100,000 population. And they're looking at approximately 20 cases, 20 new cases per 100,000. So it's a bit difficult in Kahnawà to do that considering our very small population. So we have three elements that we're going to focus on a little bit more closely. Number one is the number of cases, the number of new cases. And so anything under one new case per day, one localized, individualized case per day is considered low incidence. As soon as we go up over more than one new case per day, we consider that increased vigilance. So we have to be a little bit more careful, and we'll have to look at elements of stricter measures that we would want to implement. And so that's a lot of the planning that's happening right now that Lloyd has spoken about and spoke about this morning on K103, is that we will be able to provide to you some more details about those measures as we move forward. But right now we're going to just focus on the elements that would require those stricter measures. So again, number of cases. And not just the number of cases, but where are they located? So are they individualized cases? Are they interconnected? Are we seeing signs of transmission, community transmission? Or again, is it one individualized case? Those are things that we have to analyze. We also need to look at the number of people who are actually being tested. And if we maintain less than 2% of positive cases of the total amount of people being tested, that's an indication to us that we're still doing okay. So as soon as we go above that 2%, that's an indication that we are need to look at additional safety measures. The final element that is really important to keep track of is our ability to identify cases, contact trace, and isolate people. Dr. Gauthier has spoken about this often. So identify, contact trace, isolation, that's the kind of the recipe to ensure that we limit transmission of the virus. So if we are unable to test, or if people are not coming to be tested, or if we cannot contact trace, so identify who all the contacts were and self-isolate quickly, then that's a sign to us that we're having difficulty and that we're nearing towards implementation of increased measures. So again, those three elements are very important. So, and those are the things that we will follow as a task force on a regular basis. So your responsibility as individuals and as a community is to maintain physical distancing, maintain your hygiene measures, and the third one, I'm all of a sudden, so hygiene, physical distancing, and masks. So to make sure to wear your mask. So that's your responsibility as a community. Our responsibility, again, will be to follow the elements that I spoke about and to make sure to continuously and openly communicate with you so that you're aware of what's happening and you understand the measures that we have to implement. Why am I talking about this today? We think it's important to start talking about this because we do see this gradual increase, and we need to be prepared for the coming weeks and months. We need to start preparing ourselves for the fact that changes could happen rather quickly. So we have to follow this on a day-to-day basis to be sure that we're protecting the community and each of you as much as possible. And we have to feel comfortable and confident that you're also doing your part in this process so that as a community we can stay safe. I want to talk a little bit about visitation at KMHC, and I spoke about it last week. Again, a reminder that the rules that we have in place are there for a reason. We know what we're doing. We've put these rules in place to ensure as much as possible the safety of all your loved ones, to mitigate the risk involved in visitation. Even so, since we spoke last week, and even though we clearly express the rules to visitors, we still have situations where people are not masking when they're taking walks, or more people are joining in on the visits than were originally planned. And of course, that means that we have not triaged these people to ensure that they are symptom-free. And so there is increased risk in these situations. And so I just wanted to make it clear that should we come across these situations in the future, that we will have no choice but to limit visitation for those particular people who are not following the rules. This is not a fun situation for any of us. It's actually really uncomfortable because it's not something that we want to ever have to do. However, we're responsible, as I mentioned last week, for the safety of all our residents, of all our staff, of all of your loved ones. And so we have to, we can't ignore these individual cases because it puts everybody at risk, and in the end it affects the community as a whole. So we ask you to be very vigilant about following the rules that we provide to you. They're there for a reason. We know what we're doing. We've kept KMHC residents safe up till now, and our goal is to continue that as we move forward. Lastly, I want to talk a little bit about the schools. There's been a lot of sensationalization, fear and anxiety in the media about the number of cases that have been identified in the various schools throughout Quebec. Just to keep in mind that as of this morning, there were no outbreaks in the schools. The cases that have been identified are individual cases, and these cases did not contract the virus within the school. The virus was contracted at home or elsewhere outside of school. This is important information. Again, these are things that we follow on a regular basis because it indicates to us, it gives us important information that allows us to make proper decisions. And so this information is not alarming to us. We know that the virus exists. We know that we can still have cases in the future. The idea is to understand where they come from. Is there an outbreak? Is there contact tracing being done? So the measures that the schools are taking are in fact positive. They're contact tracing, they're isolating those that need to be isolated, they're testing when required, and these are all positive solutions, positive measures that will help mitigate the risk in the schools and still allow children to go to school safely. So our schools are prepared to work in that same format. So we do have measures in place that if a child develops symptoms, they will be sent home, and they'll be consulting with the local public health team to establish whether they need to be tested or not. So yesterday or Tuesday, I spoke a little bit about A symptoms and B symptoms. So if you want a refresher about symptoms that require testing, you can go back to Tuesday's episode and take a look at that. And I mentioned on Tuesday that in the schools, we are being a lot more cautious, meaning if a child or a teacher has one symptom of all the symptoms, they will be sent home. It does not mean that they will necessarily be tested for COVID-19. So oftentimes we will have a wait and see approach. They will isolate, they will stay home, and we will wait 24 hours and we will see if a second symptom develops from the B category. So that's important because we want to make sure that community members and families know that it's not as soon as your child is sent home that they will necessarily be tested. So there is a communication strategy between the schools and KMHC, local public health team, for us to be able to determine whether a child needs to be tested and which children from that class or pod or group need to be sent home for isolation as well. And so it's a very good collaboration between KMHC and the schools, and we have all the elements in place to ensure that we are able to communicate both with the school and with families so that your children can be safe. Just a last element that I wanted to mention is there is a drop-off at KMHC this Sunday from 10 to 1. So again, same rules as we've been having for the last several drop-offs. So it's just a reminder, 10 to 1 on Sunday. So thank you very much. As we move forward, we're going to keep you up to date as much as we can about everything that's happening around us and how it might impact the community so that you can be well informed. Thank you.
Thank you very much, Lisa. And again, as was stated, I believe it was Dr. Gauthier who said last week, fear is fed by misinformation. So our job here is to make sure that you have the right information so that we can all make the right decisions as we continue to move forward. Lisa mentioned that the September 8th episode is the one that where she gave that information out, so you can check that out. And in the meantime, we wish you good health, and we'd like to thank you for watching today. On behalf of all of us here at the COVID-19 Task Force, Nyaukoa, Tano Onigiwahi.